If you're like most people that I see with lower back pain, you've probably heard that anterior pelvic tilt could be the cause. And if that's the case, you probably tried exercises to reduce or correct anterior pelvic tilt in hopes that it would alleviate your back pain. But if you're no better, or even worse, there's a really good reason for that. And that is, believe it or not, that in many cases, trying to correct anterior pelvic tilt might actually be making the root cause of your back pain worse. So in this video, we're going to talk about why that is and what to do instead. So without further ado, let's go ahead and jump right in. All right, so first things first, what is anterior pelvic tilt and why do so many people tell you to try to fix it in order to alleviate back pain? So when most people talk about anterior pelvic tilt, they're talking about a posture of the pelvis and the lower back. In this posture, the front of the pelvis comes down and forward more than the back of the pelvis. This is what causes the anterior pelvic tilt. Above it, in the lower back, we're going to see increased arching or extension. And it's worth noting that anterior pelvic tilt also has another definition, which is just any time the pelvis moves forward relative to the legs. And this is something we're going to see in squats, lunges, deadlifts, and daily movements, and we'll cover why this is important later in the video. But again, most people who are talking about anterior pelvic tilt are talking about it in terms of posture. And they'll often say that you have something called lower cross syndrome, which refers to an underlying muscle imbalance that has to do with this posture. In lower cross syndrome, it's assumed that we have short and tight hip flexors and lower back muscles. And it's also assumed that we have long and weak glute muscles and abdominals. And so, if this were the case, and this muscular imbalance was causing the tightness and pain in the back, then it would make sense to reverse engineer it. And this is the rationale behind doing glute and abdominal shortening exercises to try to tuck the pelvis under and reduce the arching. Theoretically, this would lengthen the hip flexors and the lower back muscles and would cause relaxation and relief of the tightness or the pain in the lower back. Now again, this makes intuitive sense if this lower cross syndrome were in fact the cause. But there's actually two causes of lower back pain, and each is just as common as the other. And in many cases, when you take this approach, you're actually making that underlying root cause worse. So let's cover that first, and then we're going to get into some exercises that you can do if you've tried anterior pelvic tilt correction exercises and haven't seen any results. So when we're looking at back pain, we're going to have directions of movement that feel better and those that feel worse. So if we're talking about movement in this straight to back plane or sagittal plane, we have bending or flexion and then straightening or extension. Now, if we felt more pain with extension, then doing anterior pelvic tilt correction exercises makes sense. That would round the spine and tuck the pelvis under to reduce the extension. But in just as many cases, the pain is due to the opposite motion, bending. So in this case, anterior pelvic tilt correction exercises actually wouldn't be beneficial, but would be more likely to increase the pain. And what's even crazier is that doing these repetitively could actually create mobility limitations that will make it more likely that that back pain will keep coming back in the future. To understand how these mobility limitations can contribute to lower back pain, we can think of movement through the body as links in a chain. So if I'm going down to touch my toes or I'm doing a squat, I need to get movement between the leg and the pelvis, which is anterior pelvic tilt, and I need to get movement between the pelvis and the lower back. And this is typically going to be rounding or flexion of the spine. Now, if you have sensitivity to bending, this means that you're more likely to move in the direction that causes the discomfort. And more movement in that direction is more likely to result in an increase in symptoms or a flare-up. So in this case, it becomes really important to make sure we have as much movement between the pelvis and the leg while minimizing movement between the pelvis and the lower back. And this is where it gets kind of crazy, because you'll realize that what we're actually doing is increasing movement into anterior pelvic tilt, which is exactly what those exercises were trying to correct in the first place. So now that we understand we need to increase movement between the pelvis and the leg and decrease movement between the pelvis and the lower back, let's talk about some exercises that you can use to do that. If you're getting value from this video so far, consider liking this video, and if you haven't already, subscribe to the channel. These things help the algorithm to help me help more people. All right, let's get back to the video. All right, so this first exercise is one that I call hip before back flexion. And the whole point of this is to move more at the hip and less at the lower back. We're going to use the hands to push the hips straight back here, and we're going to stop the movement when we experience any rounding of the lower back or tucking under of the pelvis. By doing this, we're going to cause the majority of the motion to happen between the pelvis and the leg, moving into anterior pelvic tilt and opening up those tight hamstrings and glutes. Now, if you're someone who did a lot of abdominal tucking exercises, you might have to use this cue. Think about letting the pubic bone, or the front side of this pelvis, come down and back between those upper legs as you're pushing backwards. This is going to reduce the amount of work that your lower back has to do, while also allowing you to be able to get maximum movement between the pelvis and the leg. Then we'll come back to the start, and each repetition we'll try to push back a little bit further with the hands and get more movement at the hip. After you've done this for about 8 to 15 repetitions, you're ready to move on to the next exercise. This next exercise is a back to wall closed chain hip flexion or anterior pelvic tilt exercise. To set up, we're going to have the feet about 7 to 10 inches away, and we're going to have the head, back, and butt all against the wall. In this initial position, we're going to take that pubic bone and allow it to come down just a little bit. This is going to create a little bit of space between the lowest part of your back and the wall. At the same time, we'll make sure the lower rib cage is back against the wall, and we'll draw the abdominals in slightly without rounding the back. This will teach us a good strategy for stabilizing the core without over-tucking the pelvis. Then, from this position, keeping the head, rib cage, and pelvis all relatively in the same relationship to each other, we're then going to push the back of the pelvis up the wall as we bring that pubic bone down and forward between the legs. As we do this, again, the head, rib cage, and pelvis should stay in the same shape, and all the movement should happen just at the hip. We'll go as low as we can without rounding the lower back, then come back to the start. We'll do 8 to 15 repetitions here, and then once we're done, we can rest and repeat for 1 to 2 additional sets. Now, if you've done these exercises and you feel like they're helping, there's a few things you can look into in terms of next steps. The first thing would be to practice these every other day for about a week and really make sure you get this skill down. If you want to learn the rest of the skills that are going to help you move and feel your best, then go ahead and get my lower body foundations and core foundations programs. Those are going to be a great combo to give you the hip mobility and back stability that you need to be able to alleviate back pain. And if you want a custom tailored solution, I also have the option to get in with me or one of my coaches for a customized movement assessment and program. So if either of those interest you, go to the link in the description. As always, like, comment, subscribe, all the things that help the algorithm to help me help more people. And until next time, peace.